The Philippine Red Cross, or PRC, is set to conduct its pilot saliva COVID-19 testing of some 1,000 healthcare workers in the Philippines this week in compliance with the Department of Health, or DOH, requirements to secure full approval of the new testing method. Saliva testing is a faster, easier, and cheaper alternative to the swab test as it is simpler and requires less processing. The test requires a saliva specimen, which eliminates the discomfort of swabbing and the need for universal transport medium and swabs. The saliva specimen, viable for 7 days, is stable at room temperature and does not require cold chain transport, which translates to reduced cost. The PRC has partnered with 15 DOH hospitals in Metro Manila to implement the test as part of the health workers' routine surveillance. Dr. Pauline Ubial, chief of the PRC Molecular Laboratories, said the cheaper test is found to have 95% concordance rate with the RT-PCR test, while its turnaround time of 3 to 4 hours is faster compared to swab tests. Saliva testing needs approval from the DOH and the Food and Drug Administration before it is rolled out for widespread use. PRC Chief Senator Richard Gordon said, should the DOH approve the testing method, the organization can process about 8,000 tests per day. In the meantime, the PRC said the saliva test can stand as a substitute to the usual swab tests. However, not every hospital can do the new method due to a limited number of machines made to process saliva samples. On another note, Gordon earlier said the saliva test would relieve the Philippine Health Insurance Corporation, or PhilHealth, of financial burden as one would cost only 2,000 pesos, half the price of a swab test. PhilHealth, which pays the PRC for the swab test of its members, especially returning overseas Filipino workers, owes the non-government organization around 651 million pesos in unpaid testing services. According to Gordon, the PRC has conducted over 1.6 million COVID-19 tests as of Sunday. For One Media Network, this is Gillian Geronimo.